Opioids can be a lot of different things. They can be the medications that are prescribed by your doctor. So examples of that would be a brand name Percocet, which has an ingredient oxycodone. Hydrocodone is another prescription medication that your doctor might give you, but there are also drugs that are available on the street. So heroin is an example of an opioid, and then kind of a confusing opioid that we're hearing a lot about is fentanyl. Fentanyl is a very strong medication that can be prescribed by your doctor, but it's also something that's commonly synthesized on the street and can be really dangerous and overdose. So there are these agents that are out there that are opioids that are being made on the street, and then there's the prescription products. Not everybody that uses an opioid or is prescribed an opioid is going to become addicted. There's, first of all, addiction, or what we're now calling opioid use disorder, is a disease. When patients are prescribed opioids for pain, on a short-term basis, their body doesn't get dependent or used to the medication, but after an individual has been using the medication for a while, their body can become physically dependent. They need the opioid to operate normally, and if they stop the opioid, they can experience withdrawal symptoms. Dependence by itself is not an addiction. Addiction is where you have both a psychological component, you crave and want the drug, and in many cases, especially with opioid use disorder, your body is also physically dependent to having the drug around. And so you crave it, you need it, when you stop it, you go through withdrawal. And that is addiction or opioid use disorder. It may not always be obvious that an individual has an opioid use disorder. There are specific diagnostic criteria that physicians use to determine if an individual may have an opioid use disorder. There's some screening tools out there that can be indicative. And what we're looking for is changes in the individual's normal behaviors. So you have somebody who used to enjoy playing guitar, used to spend a lot of time with family, stops doing those sort of things, is having issues at work where they're not coming to work on time, they're late. You may recognize that they're using more and more of their medication. If it's somebody who has a opioid that's prescribed, you see that they're now saying lower doses aren't working for them. They're constantly increasing the doses. They're going to multiple doctors to get prescriptions. That can sometimes be a tip or an indicator for both physicians or pharmacists. We have a prescription drug monitoring program, which is a statewide program that gives us information about prescriptions that patients are getting, including opioid prescriptions. And so if you see, as a healthcare provider in the prescription drug monitoring program, someone who's getting a lot of prescriptions from different sources, large amounts, that can be indicative that they may have an issue with opioids. There's a couple of different resources that you can use that are out there. They're actually, depending on where you live, Baltimore City has a hotline that you can call to help get treatment. A lot of the local health departments, if you call the health department, they'll give you resources for the area. Some of it is going to be dependent on what type of insurance you have, whether you have private insurance or you have medical assistance, but they can help direct you. Even if you're working, employee assistance programs can help with treatment referrals. You as a family member can go online and look for possible resources. There are some self-help groups that are out there, both for individuals who have issues with either alcohol or drugs, and then there are family groups. So the family groups are Al-Anon or Nar-Anon, and if you're part of those groups, one of the big things that they do is provide support and help family members work through when they have somebody in their family that has an addiction. And then there are self-help groups, AA, NA, they're 12-step groups. There's other types of 12-step groups that are out there that are self-help groups. But again, There are medications that are used to manage opioid use disorder in particular. There's buprenorphine, there's methadone, there's naltrexone, and those are medications that need to be prescribed by a doctor. Understanding that opioid use disorder is a disease and part of the treatment is going to be medical treatment. So whether that's seeing a psychologist for therapy or going to group counseling sessions or receiving medications, and there's really good data to suggest they can be very effective in an overall treatment plan to manage patients. But managing it as a disease state, getting patients assessed and treated is really important.